Hi, okay, so moving on to the next part in the road less rocky journey, so to speak, and that's when the carer takes on an active caring role. So for you that have arrived since I spoke a bit earlier, really we say taking on an active caring role is when you start to notice that your day is being taken up maybe with supporting somebody else to live at home or in the community. So maybe you're taking somebody to appointments, you're checking on them, making sure they've eaten, and then gradually you may start to find you're doing more and more for that person. Okay, so the first thing once we take on this active caring role is actually to recognise that we are carers. And I'll put a few things up there that might give you a hint as to whether somebody around you or you're a carer yourself and not recognising that at the moment. So is your day being taken up attending and organising somebody else's appointments? And quite often people who are at work used to ring me and I'd say, how many hours a week are you maybe caring for somebody? And they say, oh, I only go round for a couple of hours in the evening. And I say, well, you've taken up your hour's lunch hour to talk to me on the phone for help and advice and what to do. You need to count those as well. You know, when it's not always what you're doing for the person when you're with them, but what you're doing for the person when you're away from them, which is organising appointments, sorting out bills, sorting out what I call like the general household administration, sometimes sorting out things when they've gone a bit awry, and that can take hours. So it's remembering all of that. So when you start supervising people with their medication, making sure they attend appointments, increasingly spending more of your time with that person and neglecting your own life. I spoke a little bit about that again this morning. That you stop seeing your friends because you're too busy. You stop inviting people round for a cup of coffee because you're too busy and such like. Start cutting hours at work if you're still working. That sort of thing. So I just put up a definition as a carer, as we're trying to recognise ourselves as carers there, and it's quite generally used one throughout Carers Trust and the Carers Trust network. So a carer is someone of any age who provides unpaid support to a family, friends who could not manage without their help. This could be caring for a relative, partner, friend who is ill, frail, disabled, who has a mental health or a substance misuse problem. And of course, quite often people have more than one condition or more than one thing going on in their life. And then I've just put up as a young carer as well. And we do see young people caring for people with dementia, or being part of what we might call the caring web, so part of that caring, so helping their parents who are caring for an elderly relative who has dementia. So a young carer is a child, a young person under the age of 18, carrying out significant caring tasks and assuming a level of responsibility for another person which would normally be undertaken by an adult. So again, that's quite often arranging appointments, having this interaction with the school because the person at home is no longer able to do that. Okay. So we need to remember the positives about it as well, and remember that carers are an absolutely wonderful source of information for health and social care professionals. You are experts by experience, so nobody knows the person that you're looking after better than you do when you're spending many, many hours with them a week. And professionals, doctors, nurses, social workers can save an awful lot of time if they listen to the carer. So it's really, we do a lot of work around getting that message out so people do listen to carers more. If you're having difficulty getting your voice heard, then contact Suffolk Family Carers and they can help you there, because you definitely should be being heard. And maybe say to them, you know, I can save you a lot of time here, I can tell you exactly what's going on. Of course, in the earliest stages of dementia, it is important to remember the person is still able to make those decisions for themselves and to gradually support them to do so. So it can be very difficult. Sometimes we overcare, and that's just human nature, I think. So just be wary of... I do all the time for my old auntie, she's got dementia, and it's easier for me to do something than to let her do it. I'm the worst person for that. When I know really I should make her, well not make her, but I should support her to do it, rather than saying as I do, oh come on auntie, let me just do it, you know. But as things progress, maybe she'll need more support, and it'll be much more important to do those things. Carers they know how to communicate with the person that they're caring for. So they spend a lot of time with them. They know when things are not right. We just have that instinct of people around us when they're not feeling well and what is normal for them. You know, for example, if normally somebody is quite active and then they start to stay in bed a long time, it raises our concern that maybe they're not very well. And vice versa, if somebody is usually quite relaxed and laid back and likes to sit in a chair and read a book or watch a bit of telly, and suddenly they're pacing about and wanting to go out, then again, you know, we know that that is not the thing, that it's not the nature of that person. So it's very important that we remember that as carers we have this wonderful knowledge, first-hand knowledge of the person that we care for, and it can be so valuable to doctors, nurses, social workers. So make them listen to you. Obviously as carers we can offer reassurance to the person with dementia for the very same reason that we know them very well. If we can distract them with things that we know they're interested in, try and get a conversation going about things that happened in the past or days that we enjoyed. You know that because we spent lots of time with the person. And so be very alert for very subtle changes when you know a person very well. So remember yourself as experts by experience. So the next thing, or probably the most important thing, is that you look after yourself. Yeah. And as I said earlier, some of you weren't here, statistics show that people who care for somebody with dementia have poor health outcomes themselves. They put their needs second to the person that they're caring for. And quite often will go on to need health and social care assistance later in their life because they've almost worn themselves out through caring, really. So it's really important that we look after ourselves. And for those people that always say, well, you know, I always put the other person first, I always say to them, no, you must put yourself first. Because if you don't put yourself first and keep yourself well, what is going to happen to the person that you're caring for? And they're usually the biggest worry in a carer's head is what will happen to that person if something happens to me? Well, in order to make sure that something doesn't happen to you, is to make sure that you look after yourself and take that time out. Make sure you attend your own medical appointments. Loads of medical appointments are missed by carers every year because they can't manage to get there. So take time out when you can. Accept help when it's offered, wherever it's offered from, your neighbours, your friends. You know, hopefully, as I said earlier, we're breaking down the stigma around dementia and mental health in general so that we can start to talk to people about the help that we need. And more we're seeing dementia friends and dementia-friendly communities and all of these things. Just engage with them and see what help is available, really. Try to make time to continue to see your friends and continue the activities that you did before you became a carer. And you can consider obviously paying for help in the house and garden. Nowadays we all know in this strapped budget, these terrible cuts, that getting help and support isn't as easy as it was. But first of all, make sure that you're getting everything you're entitled to, because sometimes, especially older people, do not claim the benefits that they're entitled to, and they could be the extra income that you need to pay for the extra help that you need, say around the house and the garden. Okay. Join the local carers group, of course, and get in touch with Suffolk Family Carers and see what's on offer. And visit local dementia cafes. I think it's really important to do both. It's important to engage with other carers and to go along to places like dementia cafes where they have just such a wonderful atmosphere and everybody's free to talk openly and you can feel relaxed in that environment. It's still as important to continue to do the things that you used to do. So if you used to go to a book group, to carry on doing that so that your whole life doesn't then start to revolve around the condition and you as a carer. Because it's so important to keep all of those other networks around you that you had before you were a carer. Good to have a mixture. Okay, so help and support. Contact your local carer service. Do ask for help and support. And ask before you need it so that you know what's available when the time comes and you feel that you're beginning to get a little bit tired or want to ask some questions. A large amount of people don't are not aware to Suffolk carers or to social care services or to health until a crisis comes. And it's much easier to prevent a crisis than sort one out once it's with us. And it's much better for the carer, and it's much better for the person who's unwell. So it's really good early on in the diagnosis, and as you start to care, to find out what's available locally, even if you're not going to use it at the moment. But it's there in the back of your head, and the leaflets are on the table. So when the time comes, you know where to go for that support. And say, get it early, don't wait. Make yourself known as the carer. So when you go to the GP with somebody that you're caring for, tell the GP that you are the primary carer for that person. And most GPs will register you as such. So people are aware of your input. If you go to a hospital appointment, even if it's not related to the dementia, if you're going for a hearing test or an eye test or a diabetes checkup with the person that has dementia, make sure that person knows that you are the carer for that person. Okay. And we've got a bit about the benefits check there. Do make sure, and Age UK, Citizens Advice Bureau, they're all fantastic at filling in benefits forms. I'm sure there must be people here today who can direct you towards people who can do that, because you need a degree in benefits to fill them in. They don't make it easy, but there are people out there who are very good at it, and they've been on the training courses, they know what words to put in, they know how to relate dementia to the form, because sometimes that can be quite difficult. So, getting a carer's assessment and also a community care assessment. So there are two main types of assessment, which is a carer's assessment for the carer themselves. And under the new Care Act, which some of you may or may not have heard about, every carer should be asked if they want a carer's assessment. They have a right to a carer's assessment, and you should be offered it if you come upon social care services. Okay, and so that assesses your needs as a carer. So what you do for that person. So for example, this is your time to say, yes, my reading group that I go to once a week is my lifeline, and I need that. You know, and you make that clear in that carer's assessment. So the social worker or the practitioner that's filling it in is totally aware and can look at ways around providing respite in order for you to carry on doing that. You need to let them know about your financial situation, if you have family or friends who support you, or if you're completely isolated. You know, now a lot of people's families have moved a long way away, so they're on their own. Pretty much. All these things are really important. And if an assessment is done well, they will run through all parts of your life, and it gives you an opportunity to say how it is for you and what you find difficult. And for the person that you care for, it's called a community care assessment, which assesses their need for help and support within the community. So, at its simplest, do people need rails and toilet raising seats and stuff like that, up to do they need care visits, having a look at day services and such like. And do remember to ask for a review if your circumstances change. Quite often people will have had a community care assessment from a social worker and a carer's assessment, and then a year down the line or less, something's really changed. We talk about changing circumstances earlier. You know, maybe that daughter-in-law that helped you so much has moved away to work in a different town, and things have become much more difficult. It's really important to make sure that you ask for a review of those assessments anytime you feel you need more support.
Sorry, so where do you get those?
You would through social care services. So around here, what's it called now? Is it customer first? Or customer last, as one of my carers used to call it. I thought that was very, oh my God. Yeah, so yeah, customer first. Or if you go to Suffolk Family Carers, they will signpost you or they'll refer you in if they need be as well. So either one of those will be helpful. Okay. But if you're open to a memory clinic, the guys there also should be able to advise you. I mean, anybody that you come across, if you go to the GP and say that you would like a carer's assessment or a community care assessment, they should be able to refer you into social care services. So everybody who's working around you really should be aware of that. But yeah, it's one general number here. Customer first. I thought they were going to change their name. Okay. So, Once we start to take on an active caring role, we need to start planning for the future. So sometimes we have to have very difficult conversations with people about what it is they would like, when, for all of us really, about what we would like if we lose the capacity to decide for ourselves. You know, how we would like to be treated, what life-sustaining treatment we want, what we want to eat, what we want in our room, who we want to see, who's important to us, that sort of thing. And what sort of care that we want. You know, what do we feel comfortable with? For example, if I lost capacity and became really unwell, the last thing I want would be my family washing me. That would be, to me, just awful. I would want a carer to come in. But for some people, it's different. They would want their family, and if their family are also wanting that, that's fine. But it's also good to have those conversations as carers. What are you prepared to do as a carer? So that when the time comes, you don't feel pressured into doing things that you don't feel comfortable with. Because carers can do an enormous amount of caring at home. You know, I've met carers who are not only doing washing and dressing and changing, but also cleaning medical equipment, dealing with that sort of stuff. So it's really important to have those conversations with the person that you care for very early on, when they still can make these decisions about what it is they would like, and to be honest with one another as well about the situation. You know, lots of people promise to care for the person that they're caring for at home forever, and actually, as time progresses, we start to learn actually we're not going to be able to provide that level of care, that actually it needs professional care. And when you look at care in a nursing home, you have lots of different professionals delivering care to people, and one person on their own at home is not going to be able to do that without a lot of support. So it's really good to remember that and have those conversations. It helps with carers because it helps you to know that you've talked about it and you've decided and everybody's happy with it. So, and part of the planning and how we can do that is through making sure that we have a will, a lasting power of attorney, and advanced decisions and advanced statements, which I'll tell you a little bit more about. So, I was at a memory conference the other day, and they asked how many people in the audience had a will. So how many people here have a will? Yeah, quite a lot, yeah. And how many people have a lasting power of attorney? Yeah, very few. And I'm guessing that those that have lasting power of attorney either have been aware of the situation happening to someone else where they needed it, or are needing it because they are caring for somebody who will possibly lose capacity in the future. We don't think about it as we think about a will. I don't have a lasting power of attorney, but I preach on about them all the time, so I think I'm going to have to do one. You know, when we make our will, we should make our lasting power of attorney. While we know what we want, while we can think about it, while we can discuss it with people, and such like, to let them know what it is we would like in our care and treatment as we grow old. Okay, so lasting power of attorney needs to be complete early, before the person you care for loses the capacity to understand the process. And that's quite important, because the person that you care for can have lost some of their cognitive ability, so their memory might be quite poor and they may be quite confused. But if they still have the capacity to make the decisions about their future, that's fine. We have to remember capacity is not whole. So a lot of people think as you have capacity or you've lost capacity, whereas actually we have to assess the capacity for each task. So, for example, my old aunt, she has lost the capacity to do her finances. She does not understand her banking at all anymore, which is a real shame because she was a financial assistant in a factory, but she can't do it. So my cousin now does it for her. But she still has capacity to decide that she wants to be cared for at home. She knows that at the moment, it's what she's always said. So it's about each issue. It's not about... So don't think it's too late, necessarily, if somebody has started to decline in their capacity to make decisions. Because... okay, so... If the person has lost the capacity to make the decision, then people need to go to the public guardian can make somebody a deputy. It's quite a long and time-consuming and expensive process to go through, where you have to get in touch with the Office of the Public Guardian and make a case to be the deputy for that person who has lost capacity. But it is still possible. Okay, so advanced statements and advanced decisions. How many people have heard of these? A few. Okay, so these go along really with a lasting power of attorney. So advanced decisions ensure that the person's wishes are taken into account later in life. So an advanced statement is not legally binding, it's more general about what we might like to eat, what we like in our room. For example, if I ended up in a residential care home, I don't want somebody bringing me one of them pack dogs, thank you very much, because I don't like dogs at all. I really don't, but they can bring me a cat. So stuff like that, you know. Some people are vegetarian, I'm not, I eat anything, but if you are, you don't want to be given a meal that's got meat in it, that sort of stuff. So it's really important, it's about how we live our lives and what's important to us. And that can be very comforting to the person who has dementia and for their carer really, to know, yeah, that's what they wanted. Okay, advanced statement, I got them the wrong way around. Yeah, an advanced decision is legally binding if it's done correctly. Alzheimer's Society has some wonderful fact sheets on their website about lasting power of attorney, advanced decisions and advanced statements. So for information about what you need to do to make it legally binding, have a look on the fact sheet or talk to your GP. And the advanced decision is much more about life-sustaining care. So whether we want to have certain procedures when we're older, you know, do we want this operation when we're 92 or something like that, or would we rather not, and about life-sustaining treatment and that sort of stuff. So they're much more meaty really. So they are legally binding if they're done correctly.
Excuse me, can I just say something about the NPA?
Yes.
My husband has Parkinson's with Lewy body dementia, and he had to go to hospital on a totally unrelated procedure. Just to say, to make sure that if you do that, to take a copy of the LPA, because they wouldn't do the procedure until I'd gone home to get a copy of the LPA and bring back so they can put it in his notes.
Yeah.
Although I did, you know, speak to the hospital, and the same with the GP surgery as well. I mean, his capacity is fine at the moment.
Yeah.
But because there was one in place, they wouldn't do the procedure until they had a copy of the LPA.
That's really strange, because if someone still has capacity to make that decision, you shouldn't need the LPA. In fact, it would be wrong. You can't register an LPA for somebody who still has capacity, so that's really strange. But that is a really good point. Actually, if you do have a lasting power of attorney, and there's two types, so I think I missed that out in my gavel. There's one for finance and housing, or property they call it, where you can manage somebody's finances and property, and one for health and welfare. So you would have been using the health and welfare there. So that's yeah. So yeah.
So they wouldn't actually do the procedure until I'd gone home. Fortunately, I lived just near the hospital.
Yeah.
But it meant leaving him.
That's really strange. Yeah. If the person has lost capacity, it's a really important point that you do always have it with you, and it is registered. And if you have advanced decision,
Can still Nigel's talk?
oh, what's he doing on?
Yes.
Oh, yeah. Nigel will tell you much more about it later. Yeah. I better be quiet now then. Okay.
See what happens when I'm not about.
Okay. So more about lasting power of attorney and advanced decisions and advanced statements.
Absolutely.
Lovely job from the professional. Okay. So when we're having these difficult conversations, we need to think about care and think about the different types of care that may be available to us. And that's to all of us. Like I said, we all need to think about these things now, not wait until we become unwell. So I will do mine when I get back from holiday, so I can say that in my talks. So we need to think about domiciliary care, if we want care at home, if we want that care increased as we become unwell, and it can be. Whether we would prefer to go into residential care, and also it's really important to make sure that we know what sort of residential care is appropriate. So there is nursing care, or there's residential care that doesn't have nurses there. There is specialist dementia care, So when we're looking for care for the person that we're looking after, make sure that we know exactly what it is we need. So speak to the medical professionals or a social worker if you have one to hand, if you're lucky enough. Then have a word with them and ask them what care that you feel you need and which care homes offer that, so that you're not wasting time looking at care homes that don't offer the support that you need. There's also supported living, so things like sheltered accommodation, very sheltered accommodation, where you have your own flat, but there's care on hand if you need it. And then in some areas there's something called shared lives, and they originally did lots of work around learning disabilities, so people would go and live in somebody else's home so they could have that care. They do a lot of respite work, but they're venturing much more into dementia, so somebody could go and have some respite in somebody else's home. Maybe somebody who cared for somebody before and that person's passed away and they want to continue, and then they maybe sign up to the shared lives schemes. Okay, so paying for care. Are you talking about paying for care?
No.
No. So paying for care is a massive issue. Yeah. The first thing to remember is, as a carer, you are not responsible for the cost of the person you care for's care. If it is deemed that they have the finances to pay themselves, then it's their responsibility to pay. That's why you need an LPA, so that you can access their finances to pay for care. So what would happen first is the person would be assessed of their need, again by social care, by getting in touch with customer first. And once that need has been established through something called the Fair Access to Care criteria, then they will be assessed of their financial ability to pay. So if people cannot afford to pay, then that cost will be met by social care. For some people, the cost will be partially met, and for some people, they'll be what we call full cost payers, so they'll pay for all of their care.
May I just ask you about the value of the house?
Yeah.
When my mother went into care, her house was taken into consideration.
Yeah.
When her capital ran down, the charge went against the house when it was sold.
Yeah.
It wasn't clear from that.
No. If explain about, Sadie was asking about having your house taken into consideration when you're paying for care, and it is a huge worry for people. If you live alone and you become unwell and you have to go into care, then your house can be taken into consideration. If you live as a couple or you have somebody who's caring for you, and you go into care, so husband and wife is the best way to look at it. So you've got your husband who's caring for his wife goes into residential care, that house cannot be taken into consideration because somebody is still living in that house that needs to live in that house. Yes. So it's only taken into consideration when there's one person left in the house, and obviously it has to be their house. If it's a shared house and somebody else is not living in there, it would only be their half. So if you're living as a couple and somebody goes into care, then that house is not taken into consideration. If your care is delivered at home, so you decide to stay in your own house and have care delivered at home, then again your house is not taken into consideration because somebody is using the house. So if someone needs that house to live in and it's their home, then it's not taken into consideration. But it is if you're the only person left living in there. So that's what would have happened with your mother. Presumably your dad had died previously, yes. So she was the only one in the house. She goes into care and you've got property that's not being used, then it is taken into consideration. Yeah.
What, so you'd have to sell it then? Is that
you can do all sorts of things now. Well, no, not now. You were supposed to have been able to do all sorts of things, but in the new Care Act, they had some new rules and regulations about paying for care, but they've deferred them to 2020, funnily enough. But still, at the moment, you can, for example, defer the payment, and so you could put somebody in there to rent the accommodation, which would help towards the care costs. What will happen is, as you said, you get a charge against the house, so that when it is eventually sold, then social care can reap back their money. So, yeah. I mean, the main thing is not to be, I think for carers is not to be fearful of it. A lot of people are fearful that the house is going to be taken for their care when they're still living in it, or if they go into care and their husband's still living in it, or their wife. And there are lots of, you have to be really careful about it, because I've come across quite pushy people who have said, oh, you need to sell the house, when maybe there's been somebody else living in the house who hasn't been a husband and wife. So, for example, I was speaking to someone who, they cared for their brother who had dementia, unfortunately, and their mum who had dementia. So, the social worker was saying, we'll have to take the house into consideration, because the brother actually needed to go into care, and the brother owned the house. And I said, no, that's not right, because there are 2 other people living in that house. One of them is vulnerable for a start, the mother with dementia. You can't take the house with somebody else who's vulnerable living in that household. And so there's no way. And also as a carer, that it does say that good practice is that you do not take the house from someone who's been caring and living there. So that is more about being a daughter who maybe has moved in and lived with their mum for 20 years. You know, by all purposes it's become their home. But not everybody's aware, and sometimes you have to put in a bit of a fight, I think, to make sure that that doesn't happen. Okay, so any more questions about that? If any, yeah, sorry.
Fair access to care has been replaced by eligibility decision.
What was it called?
It's eligibility decision recording, and it's just the same.
It's the same.
I'm a social worker.
Oh, that's even worse, isn't it?
Sorry.
It's not your fault, really. Anyway, the wording has been replaced. There.
Yeah, basically.
So something that's a real tongue twister.
Ask for it.
Yeah. Okay. Regardless of how you purchase your care, it's part of the new Care Act, part that has been enacted, is that you can receive information and advice. So a little while back, people used to, it was assessed that they needed care, it was assessed that they had the financial ability to pay for their care, so they were told to go away and sort it out themselves. That can no longer happen. If you are eligible to pay for your care, you're still eligible to get support and information and advice about what care would be suitable, and to ask the social worker or someone within the social work team to help you to arrange that. Okay.